first of all, thank you for coming. And I think this is the first time I've been giving a talk in a school, in a library. And I feel like I should start out by saying now boys and girls, we're going to have a talk on quantum physics tonight for the next hour. And then at the end, we're going to give you a quiz. Then that would be a good way to clean out the room very, very quickly. Anyway, it's been a long time since I was in the school of high school. It's also been a long time since I was in the office of the managing director of the Globe and Mail. And that was 40 years ago. And he said at that time that we were going to publish your column. And it surprised me because I'd never had 1 minute of training in being how to write a medical column. And here I was going to write for the national newspaper. And a little terrifying. Also, after he said that to me, he looked me right in the eye and he said, "I hope you realize, doctor, that your life will never be the same again." And I didn't like to say why that's the case because I thought it would be a dumb question, but 40 years later, I know. It was my idea when I walked into his office that day that my plan was to write a column for maybe a year. I think I'd written about 3 books at that time. And why don't I just see what it's like to be a journalist? And I thought, well, writing a 700-word column for maybe a year would be all right. Maybe 2 years, but the thought of beyond that, no. And here I am, 40 years later, and I have every year, 52 weeks of the year, written a medical column. And I think my wife has the right answer to that. She says, "Go see a psychiatrist." And little did I realize when I came out of that office that day, that during that course of 40 years, my life would be threatened on several occasions. In fact, one occasion I had to carry a gun for a year and sleep with a gun for a year, and I never thought that would ever happen. But I came to realize after these things were happening that Voltaire, the French writer who was born just before the French Revolution, he had a bad habit. He was a writer and philosopher, and he had a bad habit of criticizing the government. And he was eventually thrown he wasn't beheaded, but he was thrown into the Bastille. Not exactly a 5-star hotel. And while he was there, he wrote something that I have never forgotten. He said, "It's very, very dangerous. It's very, very dangerous to be right when the government is wrong." And I have found over the years that also, I haven't been beheaded, I haven't been thrown into jail, but I have been often talking about and writing about controversial issues that other people don't agree with. For example, I have written that history will show, I believe, that the use of cholesterol-lowering drugs is the most unethical and the most dangerous medical experiment that has ever been conducted by the medical profession on mega millions of unsuspecting people. Now that's a pretty damning statement. But on the other hand, I think from what you'll hear tonight, that I have some facts to back up my statements. But anyway, being a medical journalist has been interesting. It's been an awfully interesting ride. I've done things that money can't buy, such as flying onto the USS Nimitz when it was cruising out 500 miles out into the Atlantic with the US 7th Fleet. And landing on that carrier is very exciting, I can tell you. And I've also had the privilege of interviewing, and this has been the greatest educational experience of all, interviewing very important researchers around the world. I've traveled a lot, and I can't tell you how much it's been in an educational way, and all the pros and cons of writing a medical column, the deadlines, etc., etc. It's been a huge plus. Also, I believe that from a very personal matter, being a medical journalist literally has saved my life. And we'll talk about that later on. I've just written my 9th book, and I will say it will be my last book, for sure. And it's about really how I got to 90. And I thought it might be interesting just before we start talking about cardiovascular disease, just for a few moments, to talk about 90 plus and how I got there. And it certainly has gotten me there. And I hope maybe it will, the comments in the book and the few things we'll talk about may help you to get there. The Harvey Cushing, I've been a surgeon all my life. And I studied surgery. I not only graduated from Harvard Medical School, I spent 3 years there doing surgery and elsewhere. And surgery is very important to me. And Harvey Cushing, who was one of the most noted neurosurgeons that Harvard has ever had, made a very interesting comment once. He said, there's no such thing as minor surgery, but there are a hell of a lot of minor surgeons. And he could have gone on to say that, let's have the first slide to show you how that can be. He could have gone on to say that not only are there minor surgeons, but you can get into trouble by not only major surgery, but also by minor surgery. And when I was a kid, it was the general principle, if you had tonsil, you take them out. And totally needless operation 99% of the time. The old story, if it ain't broke, don't fix it, is a pretty good piece of advice. And we've gotten to the point where people are not only getting too much minor surgery done and getting into trouble. For instance, Joan Rivers is maybe the best example of that in the last year. Just one too many cosmetic operations and had a cardiac arrest under the anesthetic and died. She could have lived a little bit longer. So those are tragedies that should never happen. There's another saying that I wrote about just a short while ago, that you can say if it's not broke, don't fix it. But what about it's partially broke? Even then, sometimes it's a good idea not to fix it. For example, with people getting so many more X-rays and ultrasounds and MRIs done than they used to have done, you can sometimes find incidental things that you go to the doctor for one thing, but they do a number of tests, and all of a sudden, hey, there's a stone in your gallbladder, just found, not causing me any trouble, but it used to be the standard practice, take it out before it causes an acute reaction and maybe a major operation. But we now know that if it's a big stone, and it can't get out of the gallbladder, it can't escape from the gallbladder like a small stone, the best treatment for that is a crematorium, because more than likely you'll live with it all your life and have it treated that way. Another good example of it's only if it's partially broken, don't fix it. 90% of hernias occur in men. And it's always a general practice that if your hernia was diagnosed, get it fixed. No one likes to have things in them that are not supposed to be there. But at any rate, the reason they would get it fixed is because it might cause intestinal obstruction. Now we know that is a fallacy, because they followed thousands of people and found out that only 1% ever had intestinal obstruction, so that you're operating on 99 people that didn't need it. Next slide, please. Now, the other thing to watch out for today is CT scans and other diagnostic procedures. There's a recent report in the New England Journal of Medicine that says that in the future, 2% or more of all future malignancies will be due to excessive radiation that we've all had. I run away from radiation like the plague, because it's like an elephant. Elephants don't forget. And there is an internal computer in our body that knows all the radiation we have. It's not like an antibiotic that you take one day and it's gone the next. It's cumulative. And how many of you would go, if I said to you tonight, look, I want you to go to the hospital tomorrow morning, and here's a requisition to have 500 x-rays of your chest taken. I think even though you don't know anything about electromagnetic activity and radiation, I think all of you would say, 500 x-rays of my chest, that's a little much. But every time you get a CT scan of the abdomen or chest, that's what you're getting. 500 x-rays of the chest, or you're getting 1,000 dental films taken. So that's all cumulative, and it doesn't do you any good. So if doctor says, I want to do a CT scan, ask him, is it possible, doctor, to get the same information by getting an ultrasound or an MRI where there's no radiation involved? Now, that's not always possible. CT scans are necessary for certain things, but often you can get around it by doing the MRI or the CT scan or the ultrasound. Next slide, please. Now, you remember the old the cartoon character Pogo? Pogo once made a very interesting remark that we've identified the enemy, and the enemy is us, and that is so true. I said, I think I wrote a column about a year ago saying we could fire half the doctors and maybe close half the hospitals if everyone, tried to live a sound lifestyle. This guy's doing, obviously all the things he shouldn't do. He's doing nothing moderately, drinking too much, smoking too much, belly fat, which is the worst kind of fat you can get. And he's a disaster waiting to happen. Moderation is the thing that he should be doing, and moderation in alcohol. My routine days are pretty humdrum at times. I get up at 5:30 in the morning, and my wife gets up with me, and we have breakfast together. And then my wife of 60 years goes into her office, and I go into my office. The reason she goes into her office is because she's my editor. And she's been my editor for about 59 years. And I was damn smart, I've done some foolish things in my life, but one really smart thing I did was I married a smart woman. Made life much, much easier for me. Believe me, you have no idea how much easier it is. She was younger than I, but she was also a graduate in honors English. Very important for a guy who's never had any training in how to write. So when I write, I throw her the column and I put it on her desk, and she puts in a column where I don't put it in, and takes out a column where I do put it in. And so it's a great asset. But anyway, at 12 o'clock, she always knocks on my door and says it's time for lunch. We have lunch together, and then I go to my office, and it's exciting. And then she goes to her office, or goes to do other things that women have to do to keep the household going. But then at 5 o'clock, I always knock on her door. I say, Susan, time for a drink. And if I've written all day, and I think everything I've written deserves a Nobel Prize in medicine, I think I deserve a drink. But if I've written all day, and then I look at the copy and think, everything I've written really deserves to go into the waste paper basket, then I really need a drink. But talking more seriously, alcohol in moderation is possibly the best medicine that's ever been invented in moderation. And I like to follow the footsteps of important people who are smarter than I am. And Sir William Osler always said, alcohol is for the elderly what milk is for the young. Very smart. And remember, Jesus turned water into wine too. I don't want to argue with him. So that we always have a little drink at the end of the day and watch the terrible news that's on television at night. But the reason that is very important is there's not just one study, but there are 20 studies in the world that show that moderate drinkers live longer than teetotalers or alcoholics. And there's a reason for that. It increases the good cholesterol, the HDL, and does something even more important than that. It lubricates the small particles in the blood called platelets, Platelets are part of the blood clotting mechanism. And if they clot together in your coronary arteries, it kills you. But if you make them a little more slippery, but alcohol does do that, then you're less likely to have a blood clot. So there is good scientific reason why, in moderation, alcohol is good for you. It's also good for the common cold. Did you know that? No. Sir William Osler was he was a wise old owl. He was professor of medicine at McGill. Then he went to Johns Hopkins, then to Oxford. He was no dummy, but he had a lot of good common sense. If you got a cold, you don't go to the drugstore and buy all that junk. He said it doesn't do any good anyway. You go to bed. And when you got a cold, and when you're ache and paining, and isn't it so good to go to bed? Pull the covers up over you, and then this feels awfully comfortable. But he said, before you do that, you've got to do one other thing. You got to put your hat on the bedpost. And then you go to bed. But even before that, you got to do one other thing. You got to take a bottle of whiskey to bed with you. And all you do is you have a little sip, and a little sip, and a little sip, and a little sip. And then when you see two hats, you stop. Anyway, what's the next slide? Now, reason I show that slide is because the fellow who was just shown to you, who is a disaster waiting to happen because of his obesity and his belly fat. There's been hundreds of books written about how to reduce, and all the treatments that they're constantly throwing at you and how to lose weight. But one thing that does help to really lose weight, if everyone would do it, is increase the fiber content. Now this won't happen to I've only seen one case of this. But the point is, most people in North America take 15 grams of fiber a day. They should be taking 35 grams. Why? Because first of all, it cures constipation, and it also is there's a good possibility that the recent report comes out that if you have an increased amount of fiber, you have more regular bowel movements and less chance of having carcinogenic material left in the large bowel because of constipation causing a cancer of the large bowel. So that there is good sense in it, but the reason it works, I could sit here right now, and I could have a drink of soda, and maybe 2 drinks of soda. It wouldn't have any filling effect in my stomach at all. But if I sat here and had an apple, more than likely I wouldn't want 2 apples, because of the fiber in the apple fills the stomach, tells the brain I'm full. And so I always start out with breakfast with I get about 15 grams just with my breakfast, with fiber 1, put a little fruit on it. I'd rather have ham and eggs some morning. But I know that sometimes you got to do things to make your health better that you don't like. And I don't enjoy my breakfast as much as I enjoy my other meals, but I do get a lot of fiber, and I think it helps me healthier in the long run. And so far this hasn't happened to me. Next slide, please. Now one of the big traps, that is going to kill millions and millions of people is that they don't realize about Gifford-Jones law. And Gifford-Jones law says that one bad thing leads to another bad thing, leads to another bad thing. We no longer live in the days of where you most likely die of meningitis or pneumonia or one of the infectious diseases. We're all getting older, and we're sort of wearing out and developing degenerative diseases. And the big one, of course, is obesity. And obesity leads to type 2 diabetes, and type 2 diabetes leads to coronary attack. In North America, the World Health Organization have now come up with a disastrous figure. 1 in 14 people in North America now has type 2 diabetes. And if you're over the age of 65, 1 in 4 has it. Now that that really shows we're doing a lot of bad things. Our lifestyle is lousy. And when I graduated from the Harvard Medical School, 5% of diabetes was due to lifestyle diabetes, and 95% was genetic, bad luck. In the course of 65 years, that has changed, where 95% is due to type 2 diabetes, which we really should rename as lifestyle diabetes, because that's what it is, and only 5% due to genetics. So this really is what is going to bring our healthcare system to its knees. I was asked on a radio show recently, what did I think was going to happen to the financials of our healthcare system? And I told him the story of the young boy who had a burning desire to work at the railroad station. And so he applied, and the station master said to him, you look like a smart young lad, but things have happened at the railroad station, emergencies, and let me give you a quiz, see what you would do. He said, suppose you were standing here right now, and you saw a train coming from the east. And then all of a sudden you saw a train coming from the west. And then to your horror, you found out that they were both on the same track, traveling at 100 miles an hour and just a quarter of a mile apart. What would you do? Well, the young lad thought for a moment, so the one foot, then the other foot, and then, I know what I would do. I would run and get my brother. And the station master said, why in the name of heaven would you get your brother at such a critical time as this? And the boy replied, because my brother's never seen a train wreck. In other words, it's going to happen. Those of us of my age are not going to see this, but in the next generation or two, it just can't go on. We will not have enough young people looking after all these complications. Next slide, please. Now, this has absolutely nothing to do with our talk tonight, but I can't resist putting it on because it will have some bearing particularly for the women here. This is a little young Yugoslavian girl, and I just found out about this about 6 months ago, who was living in a small town in Yugoslavia, who had an operation at 18 months of age, and ever since then has had recurrent urinary tract infections, and most urinary tract infections occur in women, not men. They can be very embarrassing and very painful. And she was about to go to the University Hospital in Belgrade, and was terrified of leaving her small town and going up to the big city hospital to have some tests done as to why this was happening. And just before she was taken to the Belgrade, her father read about UTI drops. It's a natural remedy for treating urinary tract infections. He got some, and it was the first time in all those years that she was finally free of a urinary tract infection, and she was saved from going to the Belgrade Hospital. Now, I'm going to write about this in the next few weeks because it will be coming on the Canadian market shortly, and I think it's going to be particularly valuable for women who get tired of hearing, we know where you're going, we know where you're going. And it's a natural remedy. It's better than cranberry juice. Remember, cranberry juice was an old wives' tale, but it works. Harvard showed the reason it worked is because it made the inside lining of the urinary bladder smooth, so the bacteria just couldn't hold onto it and would wash out with urination. This particular remedy not only does that, but it also has antibacterial and antiseptic properties. So I think it's going to be a real boon for women who have that problem. Next slide, please. Now, my main reason for being here tonight is to talk about cardiovascular disease. And every 20 seconds there is a patient who has a coronary attack in North America, and every 37 seconds someone dies of it. There are 500,000 bypass operations done annually. You've got about a 50% chance of getting to the hospital alive if you have a coronary. And the heart also beats 100,000 times every 24 hours. I was amazed when I did that calculation because that's a lot of beats. And you see how it later on has very important implications for why we have coronary attack. At any rate, next slide, please. Now, most of the things I learned in surgery obviously were at the Harvard Medical School, but the interesting thing is that from here on in, what I'm talking about now has not a damn thing to do with the medical school. It has nothing to do with the 5 years of surgical training I have. It has everything to do with being a medical journalist. And that is what we're going to talk about in the next while. But before we do that, I want to tell you a story, because I don't want you to go home with the wrong impression tonight. That would be the wrong thing to do if you all went home and carried the wrong information with you. And the story is about the man who had a hell of a fight with his wife. Terrible fight. No, he literally called her every name in the book. And before he slammed the door and left, he called out to her, in addition to all the bad things I've said about you, you have for years and years and years been a lousy, lousy lover. And slammed the door and left. Well, you can imagine what happened. And 24 hours later, a lot of guilt. He's had a loving wife for all these years. And why would he ever say things like that to her? So he decided he had to make a really about turn and go home and apologize. So he bought her some roses, and he's going to go out and wine and dine her for in the evening. So he arrived home around 4:30 in the afternoon, and no one was there. But he thought, well, she's out shopping or doing something else. She'll be in shortly. 5:30, she still wasn't in. 6 o'clock, she wasn't in. So he thought, well, she's got to be in shortly. So I'm going to go upstairs and have shower and shave and clean up for a good night with my wife and apologize to her. So he went upstairs and opened the bedroom door, and to his absolute shock and dismay, he found his wife in bed with another man. And he was absolutely speechless. He just didn't know what to say. And this was a shock of a lifetime. But his wife was calm, cool, and collected. She had no agitation at all. She just looked up at him and said, darling, 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 I thought it was very prudent for me to get a second opinion. So really what I'm saying tonight, I'm not your doctor. And the worst thing I could happen is, after hearing what I've got to say, is you all go home and throw away your cholesterol-lowering drugs. That's not the purpose of the exercise. This is to get a second opinion. Second opinions are important. They're important in medicine. You can lose your life without it. They're important in finance. You can lose your money without it. And they're important also even in marriage, you know, because as Groucho Marx, the comedian, once said, I was married by a judge. I really should have asked for a jury. So remember that when you go home. Don't do anything foolish. So let's have the next slide. Now we're going to talk about the dynamic duo. That means a combination of vitamin C and lysine. And we know now that it can not only prevent but reverse coronary artery disease. Next slide, please. Now you might say, well, if all this is really a momentous decision. It really is. It's a revolutionary thing that I'm going to tell you tonight. And you might say, well, if it is that revolutionary, that important, why isn't it in the headlines of every newspaper in the world? It should be. It really should be, because I think this should get the Nobel Prize. The reason it isn't is because of three main factors. Marketing 101. The company that makes Lipitor last year made $22 billion in profits. And 22,000 million, whatever way you look at it, is a huge amount of money. And I can tell you, if I were the president of not Lipitor, got a mental block. Pfizer, yeah. I want to make 23 million next year and keep my job. So I would spend, what would I do? I would spend hundreds of millions of dollars brainwashing you and brainwashing the rest of you, brainwashing your family doctor, unfortunately brainwashing cardiologists. And I'm not that smart. If I had not been a medical journalist, they would also brainwash me. There's absolutely no doubt tonight I would be taking Lipitor, made by Pfizer, finally got it, or Crestor or Zocor, one of the cholesterol-lowering drugs. I know it for sure I would be on it. And in other words, you can seduce a lot of people with money. Money is a great seducer in the world. And the companies that make these pills, I think, are more after your money than after the welfare of your health. Next slide, please. Now, in the process of spending hundreds of millions of dollars, they've also produced a disease called cholesterol. When I go to a health food store, and I think I'm going there tomorrow morning from 10:30 to 12:30 to talk with the clients, I know that people will come in and that they're over 50 years of age. Most likely they're on a cholesterol-lowering drug and about 10 other drugs. We're living in a North American society of pillitis. Too many pills, particularly too many prescription medication. And it's sad that people are so worried about going off their cholesterol-lowering drug. And I don't blame them. You know, the doctor has said, if you go off it, you may die of a heart attack. And when your own doctor says that to you, obviously you have to listen to them. But it is rather sad that the other side of the story has not gotten out as much. Next slide, please. Now, the other problem is that doctors for years have been rather reticent to accept new ideas. And that goes back a long, long time. The next slide, please. When the first obstetrical hospital in Vienna was opened 150 years ago, it's really hard to believe, and this was the University of Vienna. And doctors were going from North America to Vienna in those days to learn. So that it was a very distinguished institution. But when the obstetrical hospital was open, 1 woman in 6 who went in to have her baby delivered died. She came out in a coffin. Can you imagine what would happen in this city if 1 in 6 went out into a hospital, in a local hospital, and died? There'd be a dozen royal commissions. It was much safer in those days for women to go out in the field and have her baby. It was disastrous to go into a hospital. You got doctors were going from the autopsy area up to the labor floor, not washing their hands, carrying bacteria with them. And mind you, in deference to them, that was before the days they knew about bacteria. But you would have thought that washing their hands would have been a good hygienic move. But anyway, they weren't. And the women were dying in large numbers until Semmelweis decided he would wash his hands. And the death rate on his ward went from way up here down to practically 0. When he told his esteemed colleagues about it, they would have said to him, "No, damn good, you know, this is a miracle. We will start washing our hands." What did they do? They ridiculed him. They drove him off the hospital staff. They took away his professorship, and he died in an insane asylum years later. Another example, the next slide, Dr. James Lind, 250 years ago, was a naval surgeon, and in those days, a lot of sailors died of scurvy. In fact, a lot of sailors died of scurvy. On ships that lasted many, many weeks, it's hard to believe that in those days, 90% of the sailors didn't return. They died of scurvy. And Dr. James Lind had some lime juice on board, and he just wondered if I give lime juice to any of the sailors, if it worked. So he picked out a few sailors, because he didn't have a lot of lime juice, gave it to them, and they didn't get scurvy. When he told that to the Admiralty in London, the bureaucracy took another 60 years before they gave lime juice to sailors. And in the meantime, of course, thousands of sailors died of scurvy. Now you might say, well, Gifford-Jones, that was 250 years ago. Sure wouldn't have the day. After all, we all have iPhones and other means of communication that we're the most connected society in the history of the world. It just couldn't happen today. Next slide, please. Alan Smith was a New Zealand farmer, and he liked fishing. And he went fishing with his buddies off the coast of New Zealand. They were all hale and hearty when they left, and they were all fine when they returned. But a few days later, Alan Smith wasn't feeling well. He developed nausea, vomiting, abdominal pain, fever. Finally, was so ill he had to be admitted to hospital. And the doctors there diagnosed swine flu virus. But he became more ill each day. They gave him every antibiotic in the book. And finally became comatose, was put on life support. And several days later, the New Zealand doctors got the family together, and they said, we've done everything we can to save Alan Smith's life. All the antibiotics we've given him are not working, and we would like to discontinue life support. They would have discontinued life support if one of the family members had not read about Dr. Linus Pauling and the use of intravenous vitamin C. And they said, well, you can discontinue life support, but first of all, we want you to give our father and husband big doses of intravenous vitamin C. The New Zealand doctor said, no, we won't do it. And they said, why won't you do it? Well, because vitamin C is useless. And secondly, it's not part of the protocol to treat swine flu virus, so they refused to do it. Until 2 days later, the son arrived with someone with doctors they never liked to see. They never liked to see a doctor or anyone bring in a lawyer. And the lawyer said to them, look, you have two choices. You can remove life support, and Alan Smith is going to die, and you're going to be sued, and the hospital are going to be sued. But you can give intravenous vitamin C, prove to us that it's useless, and you won't be sued. So faced with that verdict and choice, they gave intravenous vitamin C. The first day they gave, now if all of you are taking vitamin C, maybe you're taking 250 milligrams or maybe 500 milligrams, but they gave 500,000 milligrams intravenously the first day, and then 200,000 the next day, and 200,000 thereafter. Next slide, please. Now, you must admit that Alan Smith didn't look very well. He was pretty close to death. In that slide, you notice on the left-hand side, that's a photomicrograph of the X-ray of the lungs. And the reason that Alan Smith is comatose and life support, the lungs are full of fluid. They're not working. 3 or 4 days later, you notice the lungs on the right-hand side are starting to clear. And they begin to get better each day. But several days later, Alan Smith comes out of his coma. A few days later, they're able to remove life support. And a couple of weeks later, he leaves the hospital alive and well. Now, you would think this was just a few years ago, you would think that New Zealand doctors would say, that it's a miracle. This is wonderful. We're going to read a lot about intravenous vitamin C, and it was all in the literature. It was in the literature 50 years earlier. But what did they do? They were interviewed by New Zealand television, and they said, we are delighted that Alan Smith is alive and well. But the reason he is alive and well is because all the antibiotics that we gave him suddenly started to work. So the reason I tell you that story is if it's so difficult for present-day doctors to accept a dramatic case like this, how can you accept them to accept the fact that high doses of vitamin C and lysine can not only prevent but reverse coronary artery disease? Namely, when we talk about the word atherosclerosis, we mean hardening of the arteries. And vitamin C and lysine takes hardened arteries and makes them soft again. Next slide, please. Now, I had a good fortune, and it would never have happened to me if I hadn't been a medical journalist, of meeting Linus Pauling about 25 years ago when he came to Toronto to lecture. And I spent 2 hours with his Nobel Prize-winning biochemist. He's the only person who has ever been given 2 Nobel Prizes, one in medicine for his work in biochemistry. And when I first met him in Toronto, You know, I had been at the Harvard Medical School for 4 years, and surgery for 5 years. No one had ever told me what he was about to tell me, that animals make vitamin C and humans don't. All animals do, with the exception of the guinea pig. So the guinea pig is a wonderful experimental animal to do research on, because it's the same as humans. Humans don't make any vitamin C. Humans lost the ability to make vitamin C eons and eons ago due to a genetic mutation. And Linus Pauling said the reason that this is a big, big problem is because vitamin C is needed for the production of collagen. And collagen is the glue that holds cells together. All cells in the body are held together by collagen. And of course, what Linus Pauling was saying, we are all living in what he called subclinical scurvy. We don't get scurvy. Why don't we get scurvy? Because it only takes 10 milligrams of vitamin C to prevent scurvy. And you get 10 milligrams of vitamin C in 1/6 of an orange. No wonder we don't get scurvy. But you need several thousand to prevent coronary vascular disease. For example, if you have a dog, that dog day after day makes approximately 5,000 milligrams of vitamin C. And Health Canada says we only need 60 to 90. But that dog is making 5,000 day after day genetically. But if your dog gets into a fight or an infection, he will immediately start making 100,000 milligrams a day. In other words, nature has told that dog through an evolutionary process that if he's under stress, one way or another, whether it be injury or infection, he must have more vitamin C. That's why Alan Smith got better. Alan Smith was under a hell of a lot of stress, obviously, with an infection that was going to kill him. So he needed more vitamin C to combat it. At any rate, I thought that was interesting. And I was, in those days I was writing a medical column and doing surgery, so that the fact that animals make vitamin C and humans don't, I thought that was interesting. And I also asked Linus Pauling, well, why is it so important though? Well, he said, well, the heart beats 100,000 times every 24 hours. And if you don't have enough vitamin C at a certain level in your body, the pressure is intense on those coronary arteries. In other words, when the heart beats, where the coronary arteries are closest to the heart, big pressure there than in the arteries of my big toe. So it was his theory at that time that, and he couldn't prove it, that the reason the people were dying of coronary attack is because with the incessant beating of the heart, it was a pressure problem, and there were microscopic cracks occurring in coronary arteries, and that's where blood clot would occur. So then about 10 years later, I was in Singapore at a medical conference there, and there's a Dr. William Stebbins. Next slide, please. Okay, I forgot about that one. That slide's important because we're all living in a state of generalized ascorbic acid deficiency disease, or subclinical scurvy. In other words, if you take a vitamin pill and swallow it, you can't say, go to my coronary arteries. It goes to all those arteries in your system. And if you dissect the human body and lay the arteries and veins end to end, they will stretch for 60,000 miles, twice around the circumference of the world. So that you're getting benefit not only to your coronary arteries, but to all of those arteries when you take vitamin C. Next slide. Now, William Stebbins was professor of pathology at the University of New Zealand. And we had a little chat after his talk. And we got around to talk about Linus Pauling. And he said, Linus Pauling is right about his theory. Because with my electron microscope, I can see microscopic cracks in the coronary arteries. So that was another very important point. Then once again, I go back to doing surgery and writing my column. But then, about 3 years ago, something very important happened. I was reading in an obscure medical journal that there was a Dr. Sidney Bush, who had done a very, very interesting experiment. He was a optometrist in Hull, England, and he was obviously fitting people with contact lens. And he found out, as all optometrists and eye doctors find out, that if you're using a contact lens, there's a small number of patients who get infections underneath the lens. And that can be very serious. In fact, usually with using antibiotics, you can clear it up. But looking through the literature, some people lose their eyes from the infection when you have an organism that is antibiotic resistant. So it's very important not to get an infection underneath the lens. So Bush thought, I wonder, he was also read a lot about Dr. Linus Pauling. And he thought, I wonder if I give vitamin C and lysine to patients who are going to have a contact lens, whether it will stop the infections. So he knew Linus Pauling was treating himself with 20,000 milligrams of vitamin C a day and 5,000 of lysine. He said, I wonder if I give 6,000 milligrams of C and 5,000 of lysine, if it will stop these infections. So that's what he did. But he did a very, very important thing, which he should get the Nobel Prize for. He took a picture of the back part of the retina. And the retina, next slide please. The retina is the only part of the eye where you can see arteries and veins. Nowhere else. When your eye doctor looks in your eye with an ophthalmoscope, he's looking to see whether you have cataracts, whether other problems, but he's also looking to see whether you have hardening of the arteries, because if you are a diabetic patient, he knows you will have automatically hardening of the arteries, and he wants to figure out how much hardening do you have. Now you notice the slide on the right hand, on your right hand side, is not nearly as good as the one on the right. The one on the left hand side has bigger arteries and veins. There's more blood flowing to the retina. There's more oxygen being carried to the retina. In other words, you have to ask yourself, which eye would I prefer? And I would certainly prefer the eye on the left-hand side. In other words, what he had shown for the first time is that atherosclerosis, or hardening the arteries, could be not only prevented, but could be reversed. Now that is what should be in the newspapers all around the world, and it's not. Why isn't it? Well, for those reasons we said earlier. And also Bush is an optometrist, not a medical doctor, and he has not been well accepted in Great Britain for this discovery, which it should be. And is another important discovery that is collecting mostly dust. Anyway, I was so amazed at this discovery that being a medical journalist, the first thing that makes you very, very skeptical. And I thought, this is another one of those, too good to be true stories. And most of those too good to be true stories are in that category. So I got on the plane and flew over to Hull and spent a week with him, looking at before and after photos, and what he was showing me was correct. He could find the atherosclerosis of the of the retinal arteries starting to fade away, not immediately. Vitamin C and lysine isn't like Drano, where you got a plug sink and you put the Drano in and all of a sudden the water flows down. This is a slow process where you start getting results in about 6 months' time. You can see the arteries coming back to more normal. And you have to also be a skilled ophthalmologist to see these early changes. It's only been there for a few years that you can really see them. But anyway, Bush has now been following patients for up to 16 years, and the photos don't lie. And the one message I would want you to take home with you tonight is don't forget the photos, because that is the evidence that it works. Next slide, please. Now, Leonardo da Vinci was a wise old man who 500 years ago said nature never breaks her own laws. And that slide became very important to me 17 years ago. I was writing a column on a Sunday afternoon in Toronto. It was one of those lovely days. The sun was shining, the birds were singing, and God was in heaven. Lovely day. And I was feeling pretty good because I was about to leave in a week's time to go down to Buenos Aires to see my oldest son married. And I knew in about 15 seconds I wasn't going anywhere. I was having a coronary attack. and it was a severe one. I was admitted to the Toronto General Hospital, nearly died in the first 24 hours because my blood pressure fell to a very low level. And they had to put a pump in my arterial system to keep it going, so it was not a minor attack. Luckily, survived. And then about 6 weeks later, I had a triple bypass operation done. Then of course, my cardiologist said to me, you're lucky to be alive. So we're going to put you on high doses of cholesterol-lowering drug. And that's when Leonardo da Vinci came to mind. What Leonardo da Vinci was saying, he said, nature never breaks her own laws. Don't mess around with nature. It's literally taken eons and eons to find out how much magnesium, potassium, cholesterol, and other things that we have in our body over a large evolutionary period. And if you start fooling around with nature, you can get your fingers burned. And so I remembered Leonardo da Vinci, and I also knew, because I had seen patients referred to me for surgery who were on cholesterol-lowering drugs, and I knew that cholesterol wasn't important. We know we would die without cholesterol. Cholesterol is in all our cell membranes. All of our cell membranes is a very important constituent of the body, and 25% of it is in our brain. And I had seen patients with liver problems, kidney problems, greater incidence of muscle problems, the possibility of heart attack, and cataract formation. And I said to my doctor, I don't want to go on a cholesterol-lowering drug. I want to go on high doses of vitamin C and lysine. I don't know how many of you who have gone to your doctor and you don't want to do what he tells you to do. It's not a happy scene. And I can tell you from the standpoint of being a doctor, it was not a happy scene with me. I could immediately see that he thought I was a real absolute idiot. And what makes you think you're so smart when everyone else, all the cardiologists we know, are giving cholesterol-lowering drugs? At any rate, I knew at that time that I had to be my own doctor for a while. So I decided to go against the opinion of not only my own cardiologist, but in traveling around the world, I had interviewed a lot of other cardiologists. So, and that's one advantage of being a medical journalist. I had lots of contacts to call, but all my contacts said, "You're a damn fool. You really should be on a, not just cholesterol-lowering drug, you should be on a high dose." But anyway, I decided to bet my life on it. I believed in Linus Pauling more than I believed the pharmaceutical companies, which I thought were money-driven at that point. And the science around cholesterol-lowering drugs was not adequate. So I decided to split the difference with Pauling. He was taking 20,000 milligrams a day. I decided to take 10,000 and 5,000 of lysine. So that ever since that time, 17 years ago, I've been swallowing 30 tablets a day, 20 tablets of vitamin C, and 10 tablets of lysine. And I did it for many reasons. Let's have the next slide. I also knew that cholesterol numbers really didn't mean very much. You can have a high cholesterol and not have a heart attack. You can have a low cholesterol and have one. And we know that from a recent study in Denmark, that women and men who had high cholesterols had a less chance of having a coronary and heart attack. In other words, there is very, very little correlation between whether you have a heart attack and what your cholesterol levels are. And that's something that people have a hard job getting through their head, because they've been so ingrained that these cholesterol levels are so important. But those numbers, 5.6 or 6.2 or whatever they are arbitrary numbers that doctors picked out of the air to say this is normal and it's not normal. The other thing that I didn't know at the time, but know now, that, next slide please, that if you are on a cholesterol-lowering drug, that you have about a 25 to 50% chance of developing type 2 diabetes. And you know that if you have type 2 diabetes, you've got a 50% chance of having a heart attack. Now, we've been told on television night after night after night that the cholesterol-lowering drugs are for preventing heart attack. But look, you don't have to be a doctor or a statistician to use common sense. There are millions of people on cholesterol-lowering drugs now. That means there are going to be millions of people developing type 2 diabetes. And since type 2 diabetes results in 50% of the time they have a heart attack, how in the name of heaven can you decrease the risk of coronary attacks by having large doses of cholesterol-lowering drugs? It just doesn't make sense. At any rate, year after year, I have been taking this dosage of vitamin C and lysine. And as each year went by, and I didn't die, so far so good. On the other hand, every time I say that phrase, so far so good, I think of the man who jumped off the CN a while back, and halfway down he said, no, so far so good. So far so good, not only for a period of time. But anyway, each year went by, and I was still alive. I thought I was maybe doing the right thing. And now with all the evidence really against cholesterol-lowering drugs, I have no idea why the Minister of Health does not say we're going to ban cholesterol-lowering medication. If I was the Minister of Health, I would try to bring legislation in to ban them. I think it's a tragedy that we are trying to use on a mass scale, millions of people trying to change their basic physiology, change their emotional and physical outlook, and it's dangerous. For example, 25% I mentioned earlier of the cholesterol is in the brain, and a lot of people in cholesterol-lowering drugs are having emotional problems. In fact, the best example of that is I got to know Dr. Dwayne Graveline. I think there's a slide here of him, but Dr. Graveline, who is not only an astronaut, but he was a medical doctor. And as you know, the astronauts have to be 100% okay physically and mentally. And during an annual checkup, they found that he had a slightly elevated blood cholesterol. And they said to him, we've got to put you on a cholesterol-lowering drug. So he was started on 10 milligrams of Lipitor, a relatively small dose. And the first month he was fine, and the second month he was fine. Third month he'd gotten his car one night and drove home. He had no idea who his wife and children were, total amnesia. The doctor at NASA said, you must have a brain tumor or you've got a serious neurological problem. We were going to put you through every test in the book and find out what's going on. And they did that, and they found absolutely nothing. So with great reluctance, they took him off Lipitor. 1 month later, drove home, and he recognized his wife and children. With great persuasion, he was asked to take 5 milligrams of Lipitor. And 3 months later, the same thing happened. He had total amnesia, iatrogenic amnesia of the brain. And so he was not a happy camper. He resigned from NASA, went into private practice, and he has written 2 or 3 books on why people should never take cholesterol-lowering medication. But the reason why it affects the brain, remember there's 25% of cholesterol in the brain, and cholesterol-lowering drugs all go through the blood-brain barrier. Now you can take some medication and it goes through your body, but it gets right up to the neck area, can't get into the brain. There's a barrier there. But every cholesterol-lowering drug goes in. So obviously, it is changing the physiology of the chemistry of the brain. That's why the people are emotionally upset at times. But in addition, not only is it changing the chemistry that way, but it means that when you take a cholesterol-lowering drug, it's interfering with the production of coenzyme Q10 in the liver. And coenzyme Q10 is the energy of the heart. In other words, our cars go because we've got gasoline in them. Our heart beats 100,000 times every 24 hours because of coenzyme Q10. So in other words, not only is it affecting the heart, it's affecting the brain. And every cell in the body needs coenzyme Q10. We have 10 trillion cells in our body, and all of them need coenzyme Q10 to function at an ordinary, normal energy level. So that it's no wonder that people are having these adverse reactions taking cholesterol-lowering drugs. Getting back to Leonardo da Vinci, nature never changes her own laws. Next slide, please. So I would still be taking 30 tablets a day if I hadn't, by good luck, ran into Dean Parks, who is president of Preferred Nutrition. And Dean Parks, when he heard what I was doing, he said, you know, I think we could make a powder of vitamin C and lysine and save you swallowing 30 tablets a day. And in about 5 months, we had the powder form, which is over there tonight, Medi-C Plus. And so now I take scoops of Medi-C, I put it I take 5 scoops a day, which gives me 10,000 milligrams. I'm overdosing. And I'm overdosing because I've been, for the last 17 years, been taking 10,000 milligrams, and I'm a little afraid to stop it. In other words, it's working with me. Why change a winning formula? But we know from the science that we have now that if you don't you haven't had a coronary attack, if you don't have diabetes, then 2,000 milligrams twice a day is sufficient. That gives you 4,000 milligrams of vitamin C and 2,600 milligrams of lysine. On the other hand, if you've had a coronary, or you're very overly overweight, or have type 2 diabetes, then you should take 1 scoop 3 times a day, which would give you 2,000 milligrams morning, noon, and evening. Doesn't matter when you take it. You can take it before the meal, you can take it after the meal, you can take it with water, you can take it with orange juice, and once in a while I put it in my rum and Diet Coke at night. It tastes fine. So that I'm totally convinced this has kept me alive, and now in my 92nd year, I don't think I would be here without taking vitamin C and lysine. So anyway, next slide, please. Now, in addition to being good for the coronary arteries, it also increases your immunity, decreases wrinkles. We were up in Sault Ste. Marie a while back when you would think, after talking about, stopping the possibility of stroke and heart attack, this is what people would be talking about. What were the women talking about when they're going out the door? They're talking about wrinkles, stops wrinkles. Vanity, my name is woman. But that's not true, because a lot of women are getting cosmetic surgery done these days. At any rate, it also does all those other things to you, helps arthritis. I think more and more, if more people were taking big doses of vitamin C and lysine, there'd be fewer hip transplants and knee transplants. Why? Because vitamin C is needed for the manufacture of collagen. Collagen is the glue that holds cells together, but collagen is the main component of cartilage. So if you have lots of vitamin C, you're manufacturing a lot of collagen. Collagen is the main component of cartilage. You're less likely to have bones grinding on bones. And as you see at the bottom, and even good for shingles. If you take 1,000 milligrams a day, more likely you're not going to get a shingles attack. Good for snake bite. If I were walking through the woods and had Dean Parks with me, and he had 100,000 milligrams of intravenous vitamin C, I was bitten by a rattlesnake, it would neutralize the poison. The other thing it does, and again, this is a personal story of mine. In my 4th year of medicine at Harvard, I'd returned from Montreal, where I'd taken a month of surgery, and I was just in my 2nd month of my 4th year, and I wakened up one morning with a terrible, terrible headache. I normally never got headaches, but this morning was a bad one. It got worse throughout the day. This was 1949. It was the year of the great polio epidemic in North America. By late afternoon, I knew something was quite wrong, and I called the school physician. And I was admitted to hospital. I had a lumbar puncture done, and the diagnosis was polio. And the night I was admitted to the hospital, I could sit up in bed, and I could move both of my legs. By the following morning, I could neither sit up in bed because my abdominal muscles were totally paralyzed, and both of my legs were paralyzed. And I saw my, not only medical career, but my surgical career going down the drain. And all my doctors at that point could say to me, and look, this is one of the major medical schools in the United States, and people from Vienna were now coming to North America to learn. And all they could say to me, the paralysis is getting worse, but we have no treatment for it. How ironic. If I had been in a small town in North Carolina, there was a young doctor there, Frederick Klenner. He was a family doctor. He had no training in virology. He had no laboratory facilities, but he was put in charge of a unit with 60 patients with early polio. And he had read about Linus Pauling. And he thought, I wonder if I give intravenous vitamin C, it will have any effect on the polio. So he gave all of these patients 100,000 milligrams of vitamin C intravenously for 14 days. Not one of those patients developed paralysis. If I had been there, no paralysis. Now, he reported that to the Alabama Medical Society, went in one ear and out the other. They were more interested in finding out how you keep patients alive with tubes down their throat than listening to what his research had done. He subsequently found out many other things. He found out that intravenous vitamin C could cure meningitis, could cure encephalitis, it could cure measles. In fact, there is not one viral disease that has so far been found that cannot be cured by intravenous vitamin C. And I'm sure that if they had tried intravenous vitamin C on patients with Ebola, they would have found that 500,000 milligrams would have cured them. Amazing, that is another great discovery that is collecting dust. So that, next slide please. So what will history say? I think history will say that the use of cholesterol-lowering drugs is the most unethical, the most dangerous thing that the medical profession has ever committed on mega millions of unsuspecting people. I won't live to see it, but I'm sure that the younger generation will realize that this mass experimentation with using cholesterol-lowering drugs has been an absolute disaster. So that in closing, take home some messages tonight that I hope that you remember the photos, remember that the companies are, I think, more interested in your money than they are in your health. I bet my life on it. And I just hope that by coming here this evening and not going out on this beautiful night where you could be outdoors, I hope that you've learned something and that it's been worthwhile coming to get a second opinion, and you can take that home with you. Thank you very much.
I got a question.
Yes.
Is there any risk of having too much vitamin C?
No. There's no toxic dose. As you can see, you can take 500,000 milligrams, and that does nothing to you. The big problem with vitamin C is that it's water soluble, and that means that you have to take it twice a day or 3 times a day to keep your blood level up, because every time you urinate, you lose some vitamin C. The other thing is that if you take too much of it at once, you may get diarrhea. So that if you're going to start taking, say, 2 scoops a day, you start off with 1/3 of a scoop twice a day, then 1/2 a scoop, and gradually work up, and you'll reach bowel tolerance. Usually, you're okay at 4,000. Sometimes at 6,000, it may have a little problem, but usually not. Your body gets used to it. Yes.
When you had the polio, did they give you intravenous vitamin C, or how did you recover?
With a lot of physiotherapy.
Physio.
No, they didn't know about it. The doctors at Harvard didn't know about it at that time. So no, I had to readjust my schedule, particularly my surgical schedule, and but I was able to resume my studies at Harvard and eventually graduate. And the Americans are very kind people. There was a young boy on the same floor with me, about 17 years of age. And I was from Toronto or Niagara Falls in those days. And they took me into their home for a month because I couldn't get up. I lived in Vanderbilt Hall, which was the medical residence. It didn't have an elevator, and I couldn't walk up. I couldn't walk up the stairs. So they took me into their home, and I had a lot of physiotherapy, and finally my muscles. Not all of my muscles came back. I was left with a scoliosis and some weakness in the legs, but I was able to do surgery into my early 70s, so I was very lucky.
Is there any chance vitamin C might harden the arteries?
I'm sorry?
Too much of vitamin C might harden the arteries?
I've never heard that. I think it's impossible. No. Yes.
We all know and read many articles that being overweight is not good.
That's right.
Is there any advantage to being slightly underweight?
I think it's good to be, I'd rather be underweight than overweight. I'd rather be sort of normal weight.
What do you weigh? Well, 155?
135.
135. Yeah.
And I weighed 135 pretty well all my life. No, that's not true. I had one period of my life when I was doing something wrong. I was in my office in the afternoon. I was having a Coke and cookies and things, and all of a sudden I had gone from 135 up to 155. And I knew something was wrong, and I corrected my ways. And the other thing I do, every day I step on the scale, even though I'm 135, because I don't want to be overweight. And I exercise.
I was on Lipitor for several years, and then I decided that I am going to try to get off it, because I read in a harassment magazine, which unfortunately is not any longer available, that there are certain superfoods, and there were 2 pages full. I think it was 15, 18, I don't remember all, but I switched my diet and ate a lot of this stuff, and I told it to my physician, and he said, well, we'll see. I had my physical 4 or 5 months later, and he said that your low cholesterol has gone up a little, but your good one is very high, so you're doing okay without.
Right. Yeah. I don't ever get my cholesterol levels checked, because I don't really care what they are, as long as my arteries are open.
Yeah, so I eat lots of the superfoods, such as cranberries, blueberries, avocados, and cinnamon and black chocolate, and all the dark green veggies. So that, yes, sir.
Yes, if you were thinking of getting rid of your cholesterol-lowering drug, cold turkey would not be a good idea.
Cold turkey, you wouldn't go off your...
Yeah, it's never a good idea to do anything cold turkey. Better to go off them gradually. But the other thing that you should know is that you can take high doses of vitamin C and lysine along with your cholesterol-lowering drugs. There's no contraindication to that at all. For a very simple reason. You may go home tomorrow night and have a dinner with a chicken, and chicken is loaded with lysine. You may then get up in the morning and have a glass of orange juice, which is vitamin C. Now that is having absolutely no effect on your cholesterol-lowering drugs. So all you're doing with Medi C Plus is bring it up to an effective level. In other words, there's no contraindication at all.
Did I notice there's a powder form and then a pill form as well?
Yes, when I'm at home, I'm of Scotch heritage, so that I don't like spending money needlessly. And when I'm at home, I use the powder form because it's cheaper. But when I'm traveling, I bring the capsules with me.
So one's not better than the other?
No. I just find it's much easier to put it in some liquid and swallow it, and swallow capsules.
Yes, ma'am.
What exactly is lysine?
And that's a good point. I should mention that. Lysine is an amino acid, and if you were building a house of concrete, you would put steel rods into the cement to make the concrete stronger. We know physiologically that you can prove that the addition of lysine to vitamin C will make the arterial wall stronger. So if you have we all have arteries in our head, obviously. You want them to be strong arteries so they don't rupture, causing a brain attack. So the vitamin C and lysine does two things. It keeps the artery open, and it keeps the artery from bursting. Yeah.
Yes, I'd like to say I've enjoyed your column, and I wanted to ask if the vitamin C and lysine in high doses would be beneficial to someone with mononucleosis.
With mono.
Yeah. I don't know that question because it's a viral disease. So it more than likely, it's a good question. I don't know. I'll find out. That brings up another point. You know, it's always dangerous to have a question and answer period. And there was a brilliant professor at Harvard who was routinely asked to give lecture after lecture after lecture. And one night he was being driven to the latest talk by his chauffeur, because he's a very important man. And he said to his chauffeur, you know, I'm really tired tonight. I'm really tired. And you've heard the same lecture 100 or more times. Why don't you go in and give it? And of course, the chauffeur was delighted to have his moment of glory. So he went in and he gave a superb lecture, just a superb lecture with great applause. Then, of course, the question and answer period came. And again, he was brilliant because he had heard so many of these questions over the years. But the last question, he didn't have a clue what was going on. And you could see the sweat appearing on his brow. And finally, he caught hold of himself and he said, you know, that is the dumbest, most stupid, ignorant question I have ever had anyone ask me. In fact, it is so stupid, I'm going to ask my chauffeur in the back of the room to answer it.
What did the lady ask? I didn't hear what she said. What did the lady ask about? I didn't hear what she said.
Mononucleosis.
Oh, mono.
Yes, you know.
Okay.
You never know when there's a Nobel Prize winner in the crowd, you know. Never. And remember, I really should tell people earlier and stress the fact that I have spent all my life as a surgeon, not as a naturopath. I'm not a natural doctor. The people at PNO that go along with me on these trips, they know a hell of a lot more than I do about a lot of things. I think I know a lot about vitamin C and a few other things, but I'm not, my background is surgery, not natural medicine. But I can tell you one thing I have learned being a surgeon, that every year the New England Journal of Medicine reports that 100,000 people die from prescription medication, and another 700,000 go to the emergency because of unintended consequences. No one ever goes into a health food store and gets killed. No one. They're all natural remedies. So that the one thing that I've learned over the years is if I can find something that a natural remedy to treat an ailment, I would use it before I use a prescription drug. Much safer. Yes.
Now, another question. You know, we hear and read a lot about blood pressure. Is pulse rate of no consequence? Years ago, mine was quite often in the high 50s. Now it's probably, you know, resting 64, 65. Is that not important?
Not terribly important, but it is of some importance, but not terribly important. So, but the most important thing is your systolic pressure and your diastolic pressure. And as you get older, you know, one of the mistakes that's being made with blood pressure is that, first of all, some people are being treated for blood pressure medication that don't have hypertension, because they go into the doctor's office and they have white coat hypertension. And if the only way to solve that is the only really way is to solve it is to buy a cuff and take it home with you and check your own pressures. And as you get older, you can get into a lot of trouble going to a doctor and getting the pressure to go too low, particularly in elderly patients where there's a little bit of atherosclerosis, not enough oxygenated blood getting to the brain, and then they fall and break a hip. So that you should be very careful in if you're really getting pretty woozy on blood pressure medication, which does make you often tired, sometimes Aristotle's doctrine of the mean is not followed. They try to get the pressure too low, and there's trouble.
Sir, how does the vitamin C affect shingles? Because I have shingles on the side of my head.
Yes. Well, vitamin C is an antiviral medication, and if you have an acute attack of shingles, intravenous vitamin C can be very, very helpful. But once you have shingles, and I have a lawyer friend of mine right now who has a terrible case of shingles, and we've tried intravenous vitamin C, but we got it too late. You got to get it earlier to get the best effect.
I've had them 8 months.
Yeah, you have a lot of pain with it.
Yes.
Yeah, post-neuralgic pain is.
Is there anyone around here who would give you intravenous vitamin C? You don't know?
No, I don't know. You'd have to search there's a Dr. Huey, H-U-I, in Toronto that gives a lot of intravenous vitamin C. And shingles is I just got back from my 65th Harvard Medical Alumni Reunion in Boston. And there were only 6 of us left out of our class, and one couldn't go because he called and said he had shingles. And the pain was so bad. He was professor of surgery at the University of Southern California. Nice guy. And the pain was so severe, he had to be admitted to the hospital for an intravenous drip of morphine. And he said to me over the phone, if I had a cyanide pill, I would have taken it. And you know, pain of it can be terrible. Particularly if it hits your face and your eyes.
Question. I have a question. Lyme disease is very much on our minds these days. And I was wondering, how about high doses of vitamin C? Would that have something to do to cure Lyme disease rather than these really heavy-duty antibiotics?
Well, Lyme disease is not a viral disease.
No.
And so that I don't know of any work that's been done on that. Or maybe my chauffeur knows. Anyway,
One more
unless you want to go home.
One more at the back. Yes.
I was intrigued with the photo of the eye before and after.
The eye.
The eye photo?
Photo of the eye.
He's talking about the eye photo that you had up on the board?
Mine?
He's intrigued
The
about
eye pictures.
Yeah. What about?
just because your own specimen, you've taken vitamin C and lysine in larger doses and smaller doses, maybe more so than anybody else. I was wondering if there's a test that you could have to maybe help prove your cause that it does significantly improve heart rate.
Yeah. My wife, I always tell her the way it is. She says, if you're getting a little deaf, and I can't hear all of your questions. Can you?
Have you had pictures done of your eyes?
Oh yes, I've had pictures. Matter of fact, yes, out of curiosity, of course. And the last time I went in, the doctor wanted to call in his colleague and said, I want you to look at these retina. He said, this doctor's been taking this medication for 17 years, and look at the retinal arteries. I've got good retinal arteries, yeah.
I was wondering about other arteries as well, not just retinal.
Well, there's no research that shows that if you have macular degeneration that it helps. The only thing when I was in Hull, England, looking for these photos, for a week, the one thing that impressed me was that the macula of patients who are taking vitamin C had a rosy look to them relative to the pale look of those who weren't on it. But I don't know of any research that Dr. Bush believes it does help to a degree, but even he can't prove it. So we'll all go home and have a drink now, or what?
You gotta pick a couple of names.
Yeah, we're going to get 10 people to pick a couple of names.